SWGA Sickle Cell Awareness YouTube channel. I'm patient advocate Monica. If you're visiting for the first time, welcome. Before I get started with today's video, make sure you subscribe and hit the notification bell for weekly uploads on Tuesdays and Thursdays. In today's video, I'm going to talk about how avascular necrosis is a complication of sickle cell disease, how to take preventive measures to avoid hip replacement, and the third thing that I'm going to talk about is when hip replacement is the only option. Let's get into the video. First, let's define what avascular necrosis is. Avascular necrosis is death to bone tissues due to a lack of blood supply in the body. There are symptoms. What are the symptoms? One of the biggest symptoms of avascular necrosis is when you start having excruciating pain, joint pain in your hips, in your shoulders, in your knees, in other parts of the body, but mainly in your shoulders and your hips. One of the things that I knew, what happened to me a couple of years ago, is I felt a shift in my bones. At least that's what I thought it was. Then I talked to my primary care physician and told him, I feel like my bones are shifting. So what he did was did what is called a DEXA scan exam, which means he did a test of my bone density. Once the results came back, we found out that I had the bones of a 77-year-old. Wow. So one of the things that my doctor did was, the first thing that he did was prescribe 1,200 milligrams of calcium and 800 milligrams of vitamin D. The next thing that he did was refer me to an orthopedic specialist. So I went through 6 weeks of physical therapy to make sure that I strengthened my bones and strengthened my body to make sure I can prevent, and we are trying to prevent, hip replacement. So that's one of the preventive ways. And one of the things that I have done is sometimes I wear this brace up brace, and it just helped me put things back in a line. I've talked with patients who have had hip replacement, and it was the only option. The first thing they had to do was go through consultation with the orthopedic specialist as well as their sickle cell specialist. And the biggest thing that they talked about was having the option of choosing ceramic or titanium material in their hip replacement process. And I was thinking, wow. And once you have had the hip replacement, you go through 6 weeks of rehabilitation as well as physical therapy. And I was thinking, well, that's a good thing, but one of the downsides that I've heard to having hip replacement is when you work on the right hip, it misaligns the left hip. So then you have to have hip replacement on the left hip as well. And I was thinking, wow, but sometimes it's the thing that is needed to keep you going and to keep you thriving and to keep you going, especially if you have hip replacement at a younger age. Recovery is much quicker and is much faster, and it's something that needs to be done. To those that have had hip replacement, I applaud you. And I know that a lot of them have been rehabilitated and back to their old lives and doing the things that they normally do, especially advocate for sickle cell and talking about the complications of sickle cell. Well, that concludes this video. In the comment section, let me know if you've known someone who have had hip replacement, knee replacement, or shoulder replacement. I would love to hear what you have to say and if you've experienced it yourself. Until next time, stay hydrated and stay well. Goodbye.